Hi, this is Jamie, and this is my Module 3 blog entry. Um, I scored highest in the interpersonal skills, which I guess means that I can talk to people and communicate with them, which is actually really important with management. That was always one of the big issues that I had with my previous manager, was that communication was not very effective with everybody, not just me or one other person. I think she tried to use more of like a trickle-down effect rather than communicating with everybody. So anyway, I think interpersonal skills are very important with management. How I would function as a manager in the organization. I actually don't work there anymore. I just started a new job in drug safety, but I was there for 10 years. The hospital that I worked in, all on the on the floors, they use this model called shared care, which is like team nursing. You get like two nurses and two or three nursing assistants for, I don't know, eight. I don't know if it's like 6 to 8 or maybe even 10 patients. But everybody is supposed to work at the top of their license, so that like nurse assistants would do what they were trained to do, so that nurses, and they do what they were trained to do, so that everybody got taken care of. It's kind of the same idea in the OR. I worked in cardiac surgery in particular, where it's very team oriented. You've got to work together as a team to make sure that this one person makes it out of there alive, because in cardiac surgery you have to stop their heart to operate on it and then restart it. So it's a very team-oriented, interdisciplinary approach, starting from, there's physicians, there's anesthesiologists, there's the heart-lung people, that's separate, there's a cell saver, that's separate, which, they save all the blood that gets sucked up and put it back in the patient. There's the nursing staff, which includes the scrub techs as well. So there's the pharmacy, there's the blood bank, there's the lab, pathology sometimes. So there's so many different departments working together just to make sure that this one person makes it out okay. So I think that's a really good example of the team approach that's modeled in my hospital. Also, what I think is really cool is, I read about this on the website, that they have a huddle at the hospital where, like, the physician, the nurse, the pharmacist, all those different departments, even the housekeeper, would get together and have a huddle about patients to adjust their care accordingly. I thought that was pretty cool. The skills described in Chapter 7, I would use my interpersonal skills, which are those everyday communication skills, to secure resources such as staff. I think the breakdown in communication had a really negative effect on my previous team, and we really had to work together and hold ourselves together as a team to try to force communication, and it kind of happened, but I think that interpersonal skills are very important. I think administrative skills are very important too. You've got to be able to kind of plan for the day, the week, the month, based on who you have, who you don't have, who you'll need, because every day in cardiac surgery is different. You never, well, even in the hospital, you never know what's going to walk through those doors. You never know what you're going to get hit with that day. So you've got to be able to kind of improvise and plan accordingly. The published literature, the article that I read was really cool. It was called "Improving Patient Safety in the Operating Theater and Perioperative Care: Obstacles, Interventions, and Priorities for Accelerating Progress," and it's from the British Journal of Anesthesia by Sevdalis, Hall, and Bernock. It's from Australia. So, but one of the poignant statements that they made is, patient safety is predicated on trust, open communication, and effective interdisciplinary teamwork. And that's, again, I strongly emphasize teamwork, and I think that that's really important in order to effectively take care of patients, is teamwork, and to take care of people. Identify the levels and departments that I would need to work on. I would need working on some of the administrative stuff, like if I was to consider management. I've never been a manager. I have no experience with budgets, except my own, and what the bottom line is. I mean, I know that the bottom line is always to take care of patients, but I also recognize that a healthcare system is a business, and in order to keep the business alive, you've got to make sure that your budget is within budget and within reason. So I would definitely need work on that. Um, I think I would prefer a more horizontal structure, but using an interdisciplinary approach. All the different departments working together as one. Um, so if you have several departments caring for one patient, each with one role, working together, communicating effectively, there's usually a positive outcome. So I believe in the horizontal structure. But I also what I really wanted to implement in my previous unit was cross training. We had a lot of nurses who didn't do everything that they was within their scope, and I really think it's important for everybody to work and do what's within their scope and cross train so that they can pitch in wherever and whenever. I guess that's it. Thank you. Hopefully this works.